Welcome to week 7. This week we're going to be looking at chapter 6, sales, governance, and administration. Please keep in mind that when you look at the objectives, everything is in order in each chapter. All you have to do is follow it. There will be a section on sales. There will be a section on governance and administration. You have to keep in mind the difference between, let's say, for instance, sales, marketing, governance, and management. Sales are not the same thing as marketing. Governance is not the same thing as management. Those things are clearly outlined in the e-text. Some of these things are on the exam for this week, as well as the previous chapter, which was chapter 5, which was utilization management, which is called UM, quality management, which is called QM, and what accreditation is. You should understand the difference between those three also for the test. What utilization management is, what quality management is. They're not the same thing. And what accreditation is, and why accreditation is so important. If you look back through the discussion boards, and if you also look back through our chats for the last, I'm going to say 2 weeks, some of these topics are covered. Even if you did not go to the chat, you can go back. You don't even have to really click on history. You could simply go click on the chat and go to the dates for the last 2 weeks, which would be whatever the date of the last Tuesday was and whatever the date was for the Tuesday before last, and see what we talked about. One of the biggest problems that I noticed is that many of you like to guess and rush. I know graduate students who do this also. It is in your best interest to read through the chapter and know where things are. I will tell you on the final exam, I will cover more things on the final in such a way that is more in depth, which will force you to have to read or know how to do the research within the e-text and also do research online. Now, I'm looking at exam 3, your midterm. It's not that bad, but you must do research. There's a section here, again, chapter 5, on utilization management, which I will not go over. There's another question on utilization management in that chapter also. From what I said earlier, you should be able to handle this next question. Yes. What is the difference between governance and management? What is the difference between governance and management? That is clearly outlined in the first page or 2 of chapter 6. Again, this question also has to do with that. In our chat, we talked about the C-suite, which means CEO, CFO, CMO, CNO, Chief Compliance Officer. The thing is that insurance companies, HMOs, all of the payers are required to adhere to certain governmental standards, regulatory standards, in two ways. One is how they deal with the consumer, and the second one is how they run their business. Therefore, you must be in compliance in those areas. Therefore, at the C-suite level, there is a chief compliance officer who looks over that. They also may look over risk management to keep the company out of legal and or regulatory problems. No one wants to get sanctioned, and no one wants to get sued. This next question is also the C-suite. If you look up insurance commissioners, United States insurance commissioners, and you looked up, let's say we did a search that said 50 insurance commissioners. Although there are other territories of the United States, this simple search of 50, the number 50 insurance commissioners, that search in Google, will it tell you that that these commissioners only cover the 50 states and not the territories? Do they cover all the territories or just the 50 states? Keep that in mind. Do the 50 insurance commissioners cover just the 50 states or also U.S. territories? What is the purpose of managed care? Think about that. Is it just about insurance? Or, again, a question that was asked in chat, what is the iron triangle of insurance? What is the iron triangle of insurance? Or we could say, better question would be, what is the iron triangle of healthcare? You can answer one of those, two of them, or all three. But in your answer, they're very specific what they are. The iron triangle of healthcare. There are three things that are focused on. In the question, there may be one of them asked about, two of them asked about, or all three asked about. When you see them, you will know. I would go online and put in the iron triangle of healthcare, write them down, and if they pop up in a question, am I going to say A, B, C, D, or E, or am I going to say true or false, or am I going to say yes or no? Disease management and case management. If you are a caseworker for someone, you do not need to be a nurse, you do not need to be a doctor, you do not need to be a pharmacist, because being a case manager does not require clinical training. However, what about disease management? So with this said, is there a difference between disease management and case management? If you did a simple search of certified in utilization management, what would you find? There is a 3-letter acronym that we spoke about also in the chat. They are referred to as the gatekeepers in healthcare. They are the gatekeepers to specialty care. You must, in many cases, depending upon your insurance policy, you must go to them to get to the specialist. That's all I'm going to say about that. Again, question on utilization management, which makes you go back to chapter 5. What I will say is that if we're talking about past, present, or future, which one of those three is related to the word retrospective? This is a research question. If you know what a PharmD is, you know what the other one is, and you should know what that profession does. This is a research question. You should simply go to the WHO, and you can find the answer for that. There is a question with respect to epidemiology. I am an epidemiologist. I study diseases I use physics, chemistry, computer science, biology, and math to figure out diseases, track them down, try to prevent them, different things. Okay, so we know now, and as we have always should have known, that with respect to public health, the leading federal organization in the United States for public health is the CDC, the Centers for Disease Control and Prevention. Centers, not center, Centers for Disease Control and Prevention. So a lot goes into public health. Law, policy issues, medicine, different sciences. So with that in mind, there's a question that you should be to ask quite easily. I'll say that noise pollution, gunshot deaths, births, illnesses such as allergies, of course, coronavirus, HIV. These are all diseases that we're concerned about. Now, if I mentioned something in there, noise pollution, air pollution, could that be a part of public health? Therefore, falls under something that has to do with the environment. Interesting question. Okay. You should be able to figure that out. This is obvious. Keep in mind that everything that we do is for the patient. Everything is geared towards the patient. You have doctors, and lawyers, and engineers, and biomedical scientists, and biophysicists. All of these people, nurse practitioners, PAs, chiropractors, audiologists, the insurance companies, all of this is focused on the patient. So of all of this within healthcare, what is the most important of all of these? This should be obvious. I'm going to ask you to do a little bit of research. What is the OECD? The OECD. It's an organization. That should be obvious. Again, a little research. Compare these things. Alms house, poorhouse, pest house. What is an almshouse? What is a poorhouse? Is there any connection between an almshouse and a poorhouse? And what is a pest house? Again, we spoke about this in the chat, but by now you should know the difference between your premium, your deductible, copay, and coinsurance. You should know the difference in those. This you should also know. If you look back at the Blue Cross Blue Shield sheet, there's a statement in there about the pooling of resources of a local community. There was a word that they used. That word is still used today. There is a question about Blue Cross and Blue Shield here. again with the Blue Cross Blue Shield sheet, what was Blue Cross by itself? What was Blue Shield by itself? And how can you make a correlation, if you will, with Medicare? Parts A, what was Part A? What was Part B? What was Part C? And what was Part D? It's a little bit of a puzzle, but you can figure it out. Same thing. What is Part D? What does Part D of Medicare have to do with the PharmD degree? When you make that connection, you should be able to answer one of these questions. What is the connection between Part D and the PharmD degree? PHARM.D. Okay, you may not have had this before, but I will say it here. Federal laws are laid out, and these laws trickle down to the states. The federal government cannot be bothered with handling all of healthcare for all of the states. Therefore, they are handled by the individual states. So one could say that the administration and facilitation of health policy occurs at the state level, for the most part. Simple as that. The administration and facilitation. And we can see this. And if you were to look for HIV funding, it would more than likely come from your state. The initial money, maybe, I'm going to say, $500 billion worth of money, $500 billion in any given year may come from the federal government and is given to or divided amongst the states, if you will, and the states will allot them to counties and counties to cities and blah, blah, blah. Okay, so the administration and facilitation of health policy occurs at the state level. Let's see. Last thing I want to tell you, and that people mix up. Obamacare. Obamacare is interesting. Obamacare is a colloquial term. It's a piece of legislation. If you looked up HR 3590, you are going to find the 111th Congress, 2009-2010. That is the official name within Congress for what we colloquially call Obamacare. It is officially and in its total name called the Patient Protection Affordable Care Act, which is shortened to ACA, simply Affordable Care Act. So they're all the same thing, just different names for the same thing, different designators. If you will, the street name is Obamacare. The congressional designation for it is HR 3590, which was brought about during the 111th Congress, 2009-2010, signed into law by President Obama. Its full name, textually, is Patient Protection Affordable Care Act, which is shortened to simply Affordable Care Act or simply the ACA. They are all the same thing. Okay, so I would watch this first, which if you're listening to it, you are. if necessary, I would look back through last week's and week before last week's chat sessions. The text is there from them. And I would have chapter 5 available to me and chapter 6 available to me. So let's see, if I simply did this and I went to, where are we? I might have moved it. Yep, moved it up here. Going to the e-text. Read now. Here's chapter 3. So you see why I said you have chapter 5, and even if you need to, you see here provider payment. So the provider network. Do not confuse. It says the provider network is the backbone. See here? It says provider network is the backbone of managed healthcare. Within that, see the provider network. But in all of healthcare, the most important person, or the most important component of it, would be the patient. So here's chapter 5. I'm going to go to chapter 5 real quick. And I can see here utilization management, quality management, and accreditation. And with just looking at the headings, prevention and wellness, measuring utilization, for your final, I could go to any of these charts and ask questions. Here we have medical necessity and benefits coverage determinations. So many times when I ask a question, it will be in the form of with respect to medical necessity. It lets you know where to go. I love these. I love graphics. And this is figure 5-1. Remember, I said something to you about retrospective. Here's a little hint. See retrospective right here. What is right below retrospective? Keep this in mind. This section, come to here, so you see concurrent. We have basic utilization management. So when you look at this, we have concurrent. In here, we have all these wonderful things going on. This concurrent. This is perspective. So this here is what? Prospective, concurrent, retrospective. Future. You know, if you go to a website and it says prospective student, possible student, future student. So prospective is future. Concurrent is now, present. And retrospective is the past. There's a hint in there. Okay, so that's it. Take your time and do not rush, please, on the test.